Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
You can also support the show by making a donation. Simply go to our show notes and click the link at the bottom of the page of any episode. Thanks for listening.
We hope you enjoy the show. Welcome to PetAbility. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Chris. How are you doing today?
Good morning, Kathy. I'm actually very well. I'm very relieved. We just moved to a new home after about 9 months of trying to get there. So we've been in the new house about 2 days, lots of boxes around, but wow. I'm happy to report because everybody is asking, how are your dogs doing with all this transition? They love it.
Fantastic.
They love the new house. So I'm so happy about that.
I was worried about them too, Chris. And you know what you could do with those leftover boxes, your moving boxes? Foraging boxes. You could turn them into enrichment.
That is so true. Which maybe we should put a plug in for our sponsor.
Oh, yes, please do.
Yeah. So it's called A Dog's Best Life Box. And we have all the information on our show notes. And if you use the code PETPOD22, all capital letters, when you order your dog's own enrichment kit, you get a 10% discount. You get a cool little treat pouch with a squeaker, and it's got so many phenomenal things. So you can do a one-time, you can do a quarterly, you can do an annual subscription, you can do a monthly. It's just awesome. Anything you want to say about that, Kathy?
Enrichment.
We love it.
So, Chris, have we got a show today? I had the great pleasure of meeting a gentleman the other night, and his name is Christian Bernal, and he is the rep for PulseVet Shockwave. And just FYI, Christian says he's a big fan of PetAbility. So thank you, Christian. We love to hear that. It was really exciting to hear that you were a fan. We love that.
Self-proclaimed #1 fan. So I challenge all you others out there to try to see if you've listened to more episodes than Christian, because I think he's listened to about every one, and we have over 70 at this point.
Right. In any case, I was at a lunch and learn with him, and I was really excited to learn more about shockwave therapy. And I don't know if you remember this, Chris, back in the earlier days when we were just starting out as rehab practitioners, we were introduced to shockwave therapy, and we all got treatments, right?
Right. How can I forget?
Yeah. And although I think we all reported that we had good results, but remember, it was kind of uncomfortable.
Mm-hmm.
And it was a little difficult to get owners on board with that because, you know, we had to talk about sedating their dogs or maybe putting them under anesthesia. And so although it was a good option for treatment, it was a little bit of a difficult, sell.
I remember it was like yesterday, and it was probably, over 15 years ago.
Yeah.
Back when we were working together, and it was done on my forearm.
Mm-hmm.
And I think I have, pretty good pain tolerance. But it was an interesting feeling.
Right.
I mean, I wouldn't say like pain in the traditional sense, but again, because our pets are nonverbal, it's hard to explain this feel weird.
Yeah. Right.
But anyway, fast forward.
Yeah. Things have changed so much. Things have changed so much. And I'm really excited to talk about it. We treated the cutest little tender soul with the PulseVet Shockwave during the lunch and learn, little Phoenix who has back pain. And I was worried because he's
Phoenix a dog?
Yeah, Phoenix is a little Shih Tzu. He's wonderful. His back pain, he did the whole treatment in my lap. He sat very comfortably the whole time. We talked to him, we pet him. He just sat very comfortably the whole time. So I said to Christian, shock me. I want to know. I want to know what it feels like. And it was fine. It was really very comfortable. It wasn't uncomfortable at all. And the treatment time was significantly shorter than I remember, in the old days, right? So now immediately as a CCRP, as a rehab person, I'm like, think about all the applications that we could use this for. Dogs with hip dysplasia, elbow dysplasia, part of our pain management program, osteoarthritis, those frustrating tendinopathies. We all know we know how frustrating those are. So I was really excited to learn this about all the applications that we could use this for. So in any case, what happened after that is that Christian introduced me to Dr. Jennifer Vitucci, who is a veterinarian on the PulseVet team. And she very graciously accepted our invitation to be interviewed today. So Dr. Vitucci is going to tell us all about shockwave treatment. What is it? How does it work? Who's a good candidate for treatment? And what can we expect as outcomes? So we're going to touch on all of that today with Dr. Vitucci. But before we get started, let me just give you a little bit of background on Dr. Vitucci. She is a graduate of the Ohio State. Go Bucks, Dr. Vitucci, go Bucks. After graduating, she spent 2 years in private practice before purchasing a small animal practice. And it was her love of geriatric patients and improving their lives that inspired her to get her certification in canine rehabilitation. So she's also a canine rehabilitation therapist. And now she is a proud member of the PulseVet team. So let's please welcome to the show Dr. Jennifer Vitucci.
Welcome, Dr. Vitucci.
Thank you both so much for having me. I am so excited to be here, and I was very, very honored to be invited by both of you onto the podcast. So thank you so much. I'm excited to share all things shockwave today with you guys and the listeners.
I need to say that I had the pleasure of meeting you in person, which Kathy did not. So I'm the truly lucky one. So I met both. She professionally goes by Dr. Jen and Christian at a continuing education dinner just this past week. And like Kathy, I was really impressed. And, I guess I just want to get right into it about, how do you explain to someone who's never heard of shockwave? I mean, even the name sounds a little bit scary. What is shockwave treatment?
I know it has a terrible name, and I'm not exactly sure where that started many, many years ago, but it has a scary name, but it is simply a term for a high energy sound wave. So that's all that a shockwave is. It's literally just sound energy that we're talking about.
And I think when we had the dinner that night, you said something about equating it to thunder and lightning.
Yeah. So my favorite example that I stole from my coworkers, of course, is lightning and thunder. So lightning is an electrical impulse that actually changes the pressure of the air around it. And that's what causes the sound of thunder. And so when you wake up in the middle of the night to that big boom of thunder, I live in Florida, so we have thunderstorms all the time, and you will often feel your walls shake or your windows shake or the water next to your bed. And that is literally sound energy that's being deposited into the walls of your house. So that's all it is. It causes that vibration as the sound energy hits anywhere in your house, your roof, your walls, your windows.
So in the case of shockwave therapy, those sound waves are hitting the body and creating changes. And I'd also like to say what it's not, because, we mentioned lightning, but shockwave, you said all it is sound waves, but I want to make sure that our audience knows that it doesn't have a heating effect. It's not electricity. You're not being electrocuted or feeling an electrical impulse when it's applied, right?
Correct. Yes. Nothing to do with heat, nothing to do with electric shock. It's just sound energy. And the way it works is it is transmitted superficially, right? So we go right over the skin and the sound energy gets deposited into the tissues. And we call it acoustic impedance, but it's anywhere that there's a density change, right? So as you're going through and you hit muscle planes or you hit the top of the bone or you hit a tendon or ligament, energy gets deposited along the way. And microscopically, it actually affects the cells on the cellular level. So those cells have compression and tensile forces applied to them. I use the big fancy term, they squish a little bit. And in response to that squishing, they release cytokines and growth factors for healing. So basically the sound energy, when it hits the cells, like it hits the walls of your house, when they squish and vibrate a little bit, it initiates the body's own healing process. That's what those cytokines and growth factors are doing. It's causing the body to start healing itself.
So we're triggering the body's own repair mechanism.
Correct. Exactly.
So once we've we've triggered the body's own repair mechanism, we've actually started a cycle of healing and maybe even long-term improvement with a variety of conditions, correct?
Correct. So when we say we've initiated that repair mechanism, or I've initiated body's healing process, it actually is divided into some pretty specific things, right? So we're going to increase blood flow. And so it creates new blood vessels. The cells that line the blood vessels proliferate and expand. It causes vasodilation. So anytime you bring in blood flow to an area, right, we're going to bring in things for healing and take out the bad stuff. And then it's also going to help control pain and inflammation. So it's actually going to block some pain, decrease inflammation in that area. It stimulates cellular bone production. So it actually releases a growth factor that causes bone cells to grow. And then for tendons and ligaments, and I'll be very honest, shockwave, as you guys were discussing, it began in human medicine, but in veterinary medicine, it began on the equine side because horses love to tear and injure what they call their suspensory ligament, right? It's those big ligaments in the back of their legs. And they would rest them and they'd be in the stall for like a year and the horse looked really great. And then they let the horse go back to work and it immediately would re-injure. Because when those tendons and ligaments healed, they didn't heal back to how they started. They had like scar tissue and fibrous tissue and they weren't as strong. And what they found after shockwaving these injuries is that tendons and ligaments actually returned to this very straight linear fiber pattern, which made them stronger and much more resistant to re-injury. And so that's sort of where shockwave in the veterinary world all began. And then, of course, that transfers to other small animals and people and all sorts of other injuries. But it was really the ability to help with those tendon and ligament injuries that just take forever to heal.
I get a referral from a veterinarian that says bicipital tendonitis, I just want to run and turn the other direction.
Me too.
Very, very challenging.
Joke in people, right? It's better to break your ankle than sprain your ankle.
Right.
Because that bone is going to heal a lot faster than all those tendons and ligaments that you just damaged. And so, like you said, whenever you get those shoulder lameness referrals, you just kind of put your head in your hands for a minute. All right.
Oh, I know.
But I'm so excited that we have an option. This is amazing.
And it sounds like there's a variety of diagnoses and conditions that we could use the shockwave therapy for. Can we talk a little bit about that?
Yes. So, talking about the things that it does, right? Increasing blood flow and controlling pain and inflammation and all of that. So the things that we want to think about using it on our patients, besides tendon and ligament injuries, which are great ones, would be bone fractures. So anything that's a little slow to heal or something that we're managing in a bandage, right? So a toe break, a digit, a metacarpal, a metatarsal. It's going to speed up the time that bone heals. Chronic pain and osteoarthritis, those are huge ones, right? So it's going to help control that pain and inflammation. And actually, the other thing that shockwave has been shown to do is actually slow the progression of osteoarthritis. So, we all know when we see a patient today that has arthritis, if we take an x-ray and then we take an x-ray in a year, there's going to be some amount of progression, right? Once we're in the cycle, we're going. And so shockwave has actually been shown to decrease or down-regulate those inflammatory enzymes that are already in the joint. So it kind of helps to protect the cartilage and help that subchondral bone. And really just besides symptom management, we're kind of helping manage the disease as well. It's good for post-op pain control and inflammation. And then a little side note, not especially important in the rehab world, but I always mention it because a lot of our patients are having lick granulomas or some non-healing wounds. And this is actually a really good option for those as well.
So I guess one thing to me that is glaringly missing from this list, Dr. Jen, is intervertebral disc disease, because in my career, I've had a lot of dogs in particular that have disc issues. And I'm just curious, is shockwave indicated for discs?
So acutely, no. We don't really have any research supporting that. And we're just a little bit nervous about putting energy directly into an unstable disc. And it's hard to do that study, right? Because we don't want to make anything worse on purpose. But chronic stable IVDD that sort of has that waxing and waning back pain, this is an excellent option for that. But acute IVDD, those like immediate down dogs, probably not the first treatment option I would think of, the shockwave. It's more for chronic IVDD.
And what I'm hearing there is this, we don't know yet.
Correct.
So, okay, that makes sense. And what about, I know you said back pain, can it be used around the neck and head area?
Yes, it can. So any, or the TL junction all along there and cervical issues. Yes, absolutely.
Awesome. Love it.
Are there any other or any potential contraindications for shockwave therapy?
So yes, the other big one that we talk about, similar to, I would say, your other modalities, would be cancer. We don't really want to increase blood flow to a cancerous area in case risk of spread or anything like that. If it's palliative care, that's a different story. But the two big things are that acute IVDD right over that unstable disc, because we don't know, and then cancer, we don't want to go over that either.
Yeah, I wonder if there's any thought, for those animals that have osteosarcoma, like you said, palliative, because that's so painful when they have bone cancer. Do you know anything about that, Dr. Jen?
Yes, anecdotally, we have quite a few doctors that use it with good success for that. And also, in my mind, it's going to help stimulate some bone growth. Not that we want to perpetuate the tumor, but, for fractures and potential things like that, because that's always the other big fear, right, with the osteosarcoma. So it's a good option for palliative, especially if it's really painful.
And just to explain to our audience, so it's a tumor that grows in the bone and then can lead to a fracture because it weakens the bone at that site. So that's what we're kind of discussing here. We've mentioned, you said it kind of started in horses. It seems like everything in the rehab world starts with equine because there's a lot of money there. And they have a lot of issues. And then I know our little continuing ed thing that we had the other night, specifically the title of it was, Shockwave for dogs and cats. But earlier you mentioned kind of that general small animals. So can it be used across the board for, as far as candidates that have these different issues, but maybe are different species?
It can. Actually, a lot of the research is done in smaller pets, right? So rabbits and mice and rats and all the things. So anything that gets this indication, it's safe for even smaller animals than dogs and cats.
Can we use this modality with other treatments? So sometimes I have patients that come in a couple of times a week and I'm, I'll do my exercises in my range of motion, and oftentimes I'll use laser because I get good results with that. Can I alternate them or use them on the same patient, the same day, or maybe in conjunction or alternate?
Yes, to all of the above. So I have, even in my own practice and then clinics now, they'll alternate. If you're seeing them once a week anyway, you can put in the laser in between. There's absolutely no harm in that. There's no harm in doing them the same day, except it's not worthwhile. And then the other thing that a lot of people do is for the shockwave, maybe they pick the worst one, right? So maybe they pick like, oh, these hips are terrible, or I have a shoulder tendinopathy. And then I use my laser or my acupuncture or whatever other modalities for the rest of the body, right? For those other sore spots, the compensatory areas, things like that. It's great to sort of include it in the whole treatment.
In your whole treatment plan. And it seems like when I was doing the reading on it too, that a lot of the treatment, for expected outcomes are not that many. So maybe a dog might have a response after 2 treatments, or maybe a response after 3 treatments.
Correct. So we say 1 to 3 treatments because a lot of patients are going to respond after 1 or 2. If you have a tendon or ligament, I always tell people you're probably going to need 3, right? Those just require a lot of healing. We really want to give it the max benefit. But chronic pain and OA and other things like that often respond really well to just 1 or 2.
Then that brings to mind the question of, let's say you do get great results, after 2 to 3 treatments or even 1, and then, a year goes by and maybe you start seeing the same sorts of signs, can you repeat that in a year, that treatment cycle?
Yes.
Okay.
And sometimes if you want to do a maintenance, sometimes you only need to repeat one, or you can repeat the whole cycle and just use it as, like you're saying, like maintenance, right? When the symptoms start to reappear, we can repeat it.
Because we know it worked. And so, maybe even, like you said, as soon as the pet owner sees the sign, nip that in the bud, and then you only need one treatment because
Correct.
you caught it early.
You can't over shockwave.
No.
You can't. Okay.
Oh, I was just going to say on the horse side, right? As we were talking about before with all the money, they will shockwave from top to bottom on those horses.
I bet they enjoy it. I bet the horses like it. I bet it feels really good to them.
They do. They start to relax. We actually was just, they'll start to put their head down, right? Because their neck starts to feel so good. Yeah. And they get, kind of that floppy lip that I love that horses get when they're really relaxed.
Yes, it's so great. I was thinking, because we were talking before we got on the air about, animals and their response to the treatment and how they feel about it. And I will probably mention this in almost every single podcast because I'm very interested in the emotional lives of animals and how things we do affect them and how they respond. And I have to say, I was really impressed with the fact that this little dog that we treated seemed to be very tolerant and very comfortable. It caused him no emotional distress. In fact, when he was done, we all told him how great he was. And he was like, I know, right? He's like, I know, I'm really good at everything. And I think that was important. What my practice or practices that Chris and I work for, we try to be, fear-free. We do our best to try to make that a fear-free experience for them. And this little dog, emotionally wise, was not over threshold. He tolerated it very well.
Which is what we expect.
Right.
That's always the hardest hurdle, right? When it's sound energy, it's loud, it has noise to it. And the biggest thing is that if we're calm, usually the pets are calm. Right. It's kind of a rhythmic sound. And, very rarely does it cause them to go over the threshold, right? Once they get used to it, a lot of dogs will lean into it because I think it feels really good.
I think so. And I think that might be the one thing that might be is if I was an owner and didn't know I wasn't a veterinary technician, I might go, wow, that's a lot of noise. But if we stay calm and the dog stays calm, then we can get through this very easily. It doesn't have to be an unpleasant experience. These dogs can get through it, and cats too, as long as, if they're calm and you're cool, that the pet's going to be like, okay, mom's cool. This is all right.
I do want to emphasize it is shockingly loud, no pun intended.
It is a little bit loud.
Yeah. But so I want to just paint that picture, but I think you guys said it perfectly that they, don't react, meaning our patients, our pet friends, and I was saying too, to both of you that even with laser, oftentimes I use a laser that had a beep, right? And many pet owners would say, geez, I can't believe that my dog isn't reacting to that because, when the smoke detector goes off, the refrigerator beeps, the microwave beeps, the doorbell, they're reacting to all of these, what the owner thinks is a similar sound. But, again, we're calm. It's just like a non-issue. And I don't think I ever had a dog react to the beep of a laser ever.
I know, I hear that too, though. And you hear that a lot, like sound phobic dogs, like fireworks and things like that. And they just don't. And obviously we want to make it as positive as an experience, right? So treats and peanut butter lick mats and whatever their highest reward is what we want to be offering them during the treatment. But the nice part is it only takes about 2 to 4 minutes. So we don't have much time that we need to keep them, very quiet and happy, and then they're done.
And it was significantly shorter than the old days, when we first started working with or first being introduced to shockwave treatment. How did you guys get that time down, and how did you guys get your specific shockwave unit to be so comfortable and tolerable and shorter in treatment?
And so it's hard to describe those who have never felt what we call the traditional trodes, right? And so it's kind of like a deep tap. And what that is we call it the peak energy. So it's having this peak energy and then it has a trough, right? And so what the new trode, this sedation-free trode, has done is it has actually expanded that focal volume and in effect has lowered the peak energy. So it's kind of lowered the peak and raised up the trough. So we're still delivering the same amount of energy, but much, much more comfortable. And because it's such a large focal area, so the depth of penetration is up to 90 millimeters, so up to 9 centimeters.
Wow.
And about 30 to 40 millimeters wide, right? So we're just getting like a bunch of tissue volume hit at the same time. So we're just able to stimulate all the cells and get in and get out as fast as possible, which makes it easy.
And I think you were describing, Dr. Jen, to me that you always want to be as circumferential as possible around these areas. So this trode, can you describe kind of what it looks like if nobody has, a concept of this, and then like that you actually move it and just talk to us about what a treatment looks like?
Correct. So the trode, which is just a fancy name for the hand piece, right? Which is actually what's touching your pet. So it has an elevated sort of rubberized tip almost. That's about, I would say, 30 millimeters wide at the point that touches you. And then it gets wider at the back and has like a handle that you hold on to. And the goal is we're slowly moving it. And we do want to hit circumferentially. So we want to be above and below an injury, all around it. Not because it matters if we held it in one place. Nothing bad would happen. We wouldn't damage any tissue. We just don't get as much of an effect because we want all the cells, which makes sense, right, in the area to initiate that healing process. So we want to be all around and getting as much recruitment as we possibly can of the cells to release those cytokines and growth factors for healing. And so you do have to use ultrasound gel because we have to transmit the sound.
Oh, yeah. So let's talk about that.
Yeah. So we get a little lubed up.
Yeah.
But you don't have to push hard. We're just making contact. And that's going to make sure that there's no air bubbles so that sound penetrates deeply into the tissues as much as we want.
So what I'm hearing is that kind of air maybe blocks the transmission of the sound wave. So you need to have an aqueous medium between the trode and the skin.
Correct. Okay. So you want to make sure the trode has gelled up contact to the skin at all time. If you pick the trode up at any point and you get air in there, then the sound isn't transmitting.
So that makes me think about hair, because I remember even in the human world when I was treating people and, let's say it was a really hairy guy. Sometimes we had to, or woman for that matter, we had to shave areas to make good contact in terms of an electrode or ultrasound, because those had similar needs as far as good contact with the skin. And I learned that, the hair actually traps air. And I imagine, thinking about how furry our pet friends are, that would be a potential. So is shaving required to deliver this modality?
It is best if you can clip the hair. You don't need to do like a surgical prep, but if you have a double-coated, very hairy dog, you are going to get better results if you're able to clip an area to make sure that the sound is transmitting.
We did Phoenix because he had very thin hair. We just used a little bit of, actually used a fair amount of ultrasound gel. But I imagine a dog like Dr. Jen's would probably need to have an area shaved to make better contact, right?
Yes. And there is, conversation, right? Because obviously not every pet owner loves shaving. And if for some reason you absolutely can't shave, then I recommend we use alcohol to part the hair and tons of gel to really try and eliminate that hair trapping any air in there to the best that you possibly can.
So Kathy, you referred to Dr. Jen's dog, who we got to see before we started recording, and he is a beautiful Bernese Mountain Dog. So yes, very fluffy, very furry.
I'd like to squish him. We'll talk about that off the air. Okay.
Okay.
I think the other thing that's an easier sell for me when I talk to clients about shockwave is that there's no need for sedation with this one. Where in the old days, we had to sedate dogs, and some dogs we had to put under anesthesia because of their conditions, that it was going to be painful. But there's no need for sedation. That's correct?
Correct. No need for sedation. It is much more comfortable now. And I would say, to our previous conversation, it's never the feeling of the shockwave. If we have patients that don't love it, it's usually because they don't like the sound. They're not comfortable that way. But that has opened up, right? When you had to sedate things in the past, it's just a whole different conversation. It costs more money, more time, more people, and really
more risk.
Yeah. And a lot of our patients are geriatrics, right? Like that's who we're, aiming for a lot in the rehab world. And so it was much more risk to have to sedate them to do this. And especially because even, for 5 or 10 minutes. Right. So now it's really kind of opened up the door to be able to use this more frequently because we can do it awake.
It's so exciting that we have so many more options for these, for our senior population for treatment of their osteoarthritis and increasing their mobility and improving their quality of life. It's really exciting that we have this available to us.
Yeah, I wanted to connect those dots because we talked a lot about the nitty gritty, in terms of cells and blood flow and decreasing inflammation. But, what does a successful, treatment outcome look like to the pet owner?
And it depends on the indication, right? So if we're speaking about those shoulder tendinopathies, Achilles tendon injuries, then the successful treatment with shockwave of those is that we go on to heal, right? We don't need any more treatment for our biceps tendinopathy or our Achilles tendon. And then with the chronic pain arthritis dogs, the successful treatment goal is that we have a longer term, more comfortable pet that can hopefully reduce the need for any sort of oral pain medication for an extended period of time.
Right.
And later in life, we can improve the quality of life, right? We can improve mobility. We can improve our ability to do all the rehab exercises with them because they're more comfortable. All of those things are what make it, that's what it looks like when it's successful, right?
Yeah. Mm-hmm. And you can give the pet owner their dog back because their lameness is reduced so they can participate in, family activities. They can go on walks again. They're not limping, and they're just more engaged, I would say in the household, because when you're painful and uncomfortable, you're not. I mean, it hurts. Yeah. It hurts to move. It hurts to, participate. So, that's kind of the general, like you said, quality of life that we're looking to restore.
I'm really excited about the fact that we could potentially either reduce the dog's medication, so maybe a non-steroidal anti-inflammatory drug, or eliminate a non-steroidal anti-inflammatory drug, because it can be tricky to give senior dogs long-term non-steroidal anti-inflammatories because they long-term can have side effects, other effects on internal organs. So the possibility of eliminating them or decreasing them, to me, is very exciting.
Yes, because we tend to sort of pass them out, not remembering how many side effects they have. Would you guys agree? Like, we think they're very benign, but they're not completely benign. Right. And a lot of dogs can't tolerate them. So to be able to offer something non-drug, right, completely non-invasive, and be off of those medications as long as we can is huge.
Yeah, I think that the pet owners are becoming smarter and really looking for those alternatives, because now, we've been educated a little bit and know that there are these side effects. And I've had, pet parents say, no, I do not want my dog on any of these medications, especially long term. And if you have a diagnosis like osteoarthritis that is managed, it's never cured, then, you are looking at potential long-term drug usage. So yeah, this is fantastic.
Well, and to mention that too, on the pain meds, think about cats, right? Like, we don't have hardly any good pain management for cats. And we all know how much arthritis they have. That's basically, we underdiagnose it. And so this, to me, is a really interesting thing for those kind of patients as well, that don't really, they can't really go on long-term NSAIDs.
Right. And I think in cats, their soft tissue injuries or their osteoarthritis is probably underdiagnosed. And so to have an option like this is fantastic for them, because we really don't have any great, medications for cats.
And they're so good at hiding it.
They're so good at hiding it. I know.
So I'm going to ask the $1 million question this time. Pun is intended. How much does this cost? What can a pet owner expect to pay? And how is it priced out? In other words, is it per treatment area? Is it per session? Can you talk about that a little bit, Dr. Jen?
Yes. So the average cost per treatment, right, depending on where you're located in the world, is about $300. And that is for one area. And then usually most places will do a package, right? So if we're doing 3 treatments or we're doing both hips or something like that, we'll do a little discount on the other areas of the body. And I'll just put the plug in there about the cost, because there is a lot of sticker shock, right, for pet parents when we talk about that, depending on the area. But when you're thinking about daily NSAIDs and other modalities and joint supplements, right, and all the things that we do, it fits into that yearly thing when we're talking a couple treatments per year, right? It fits into it better than it sometimes sounds right off the rip when I say $300 a treatment.
Right.
And when you say per area, the area of pain and above or below, that's
correct.
One area?
Correct. Is one treatment. So one hip would be one treatment, right? But the other hip is an entirely separate treatment.
Okay.
And you were saying that a lot of clinics will charge $300 for the first hip, and then when they treat the other hip, it might be reduced to $250 or something like that.
Exactly. Sometimes too, that would be the same for like a tendinopathy, like, oh, we have to do 3 shoulders, right? We do a little, instead of $900 for 3 treatments, we do a little package, like a little bit more affordable, because we know we're like going to need those 3 treatments.
In my experience with packages in the rehab world is it does create that compliance and that buy-in, because again, if you have that expectation that, to work best, it's going to take 3 treatments to quote heal that tendinopathy, then you really want to give the best potential for maximum healing and outcomes. So you don't want people to flake out after one because their dog is so much better. We want them to get all the way better.
Exactly.
And Dr. Jen, are there currently any health insurance policies that will cover or help cover the cost of an alternative or shockwave therapy treatments?
Yes. So I will say most of the big ones cover up to 3 treatments. Nice. The thing to know with your specific insurance is sometimes you do have to carry a rehab. It falls into the rehab category in some insurances. So you need that rehab rider, right? Like that little extra but it usually covers up to 3 treatments for any of the indications that we've talked about, even though it falls under that rehab world.
That's good to hear.
Is there anything else that you'd like to add? Because I feel like we've covered a lot here, and we're always interested in, having our guest speak to, final thoughts or that pearl of information that they want to leave our audience with.
I know we did cover a lot. It was good conversation. And I think the thing for me that I always like to end with, and we were just recently speaking about it, that's the 3 of us, is that this is a longer term option for our chronic pain, OA, those hard to treat, difficult diagnoses, that is drug free. And I think that that's huge. And I would like to say too, just on PulseVet specifically, we are very big into the research, right? So as far as modalities go, and especially in the rehab world, we have some of the most published research on how effective this is to treat these things in our small animal patients. And so I think that that's huge. There's really a lot of evidence and research supporting this use, and we're doing more and more. Some at The Ohio State University, Kathy, in Colorado City.
Go Bucks, go Bucks.
I know. We always have to put that plug in, right?
Go Bucks.
And so I think that that's huge. I want pet parents and doctors to feel confident when they recommend this, that, it isn't new. It isn't something we've never used before, right? We're pretty confident, and we have a lot of research proving that it works and that it's super safe. And I think if you remember nothing else, that it's safe and proven effective, then I feel like I did my job here today.
Right.
If your veterinarian is thinking about using this as a modality, they can consult with the veterinarians on staff at PulseVet, correct? So the veterinarians can reach out for protocols and so forth.
Yes.
Right.
Yes, we are available anytime. There's 5 of us. spread out across the country and the world. And we're always available for questions. And if we don't know, we know the specialist to ask who might know the answer.
So I have a few comments here, ladies. One is that I belong to a vet rehab listserv, and recently there was discussion regarding Shockwave. And there were so many members that said that they would rather give up many of their other modalities than their Shockwave, that their Shockwave is the number one item that they like to employ with their patients, which I thought was huge, because these are all the big players out there that are doing rehab across the United States and world. So that was really an aha moment for me. And then the other night, Dr. Jen, when we were talking, I guess what really resonated with me, unlike, let's say, a drug, you said the worst thing that can happen, which it rarely does, but the worst thing that can happen is that Shockwave does nothing. There isn't, something that is potentially going to be bad. You just may not get the result that you hope for. True?
Correct. That's the nice part. Like you said, which really resonated, is that you can't really do any harm. The worst thing that happens is it doesn't work.
Right. Right. And then my final thing, when I received my treatment the other night, I challenged Dr. Jen because I have this area of pain in my neck, and it's been there for at least 5 years, and it's painful to the touch. It causes me to have headaches. It's painful when I move my neck and do any stretching. I can always feel it. And I've seen multiple practitioners, massage therapists, structural integrationists, a couple different chiropractors. As a physical therapist, I've treated myself. And one of those chiropractors is actually a cervical or a neck specialist. Still been there. It's gotten better, but still been there. And so I said, Dr. Jen, if you can make this spot feel better, I will be a true believer. And I was a little bit of a naysayer, I'm skeptical by nature. And so she performed the treatment. It was a miracle. For lack of a better word. A true blue miracle. I haven't had a headache since, and it's been about a week. It's not tender to the touch. I can move my head in all different directions and stretch my neck. It is amazing. And I would love to have another treatment very soon. That's all I have to say.
I was just thinking, Chris, we need to get you another treatment in the next week or so. So we are going to hook you up with Christian, at least at the minimum, because you are feeling so good and we want to continue the feel good.
Yes. That's right.
Well, awesome.
Dr. Jen, thank you so much. We learned so much today. And if you could just let our audience know, where can they find you?
So if they want to find me, they can actually go to pulsevet.com, and my information is on there, as well as a bunch of research and videos and all sorts of useful information that they can find. And you can also find out, if you're a pet parent, where a Shockwave might be near you, if this is something you're interested in. So we have a Find a Vet feature on there that will also link you up with vets in your area that can offer you this treatment.
Wonderful.
Wow. So it sounds like pulsevet.com is a great resource. Can you spell that just so people
Yes,
know?
It is PULSEVET.com.
Awesome. Thank you.
You are welcome. You guys are so lovely. Thank you so much for having me.
Thank you, Doug.
No, thank you very much. I hope you have a wonderful rest of your day. Thanks for being here.
Thanks. Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
For more information about Kathy's books and living with blind dogs, please visit enableyourpet.com. Thank you, and please tune in next time.